Here is your stem.
Okay, ma'am.
All right. So if you've read and understood,
Yes,
considering
ma'am.
it anatomy, surgical anatomy station, please tell me. This we have already identified. Okay, before I ask you to identify the structures, please tell me how many carpal bones are there?
Uh, 8 carpal bones.
Please complete answer. 8 carpal bones which are arranged into 2 rows, proximal and
Yes,
distal, yes, and then
ma'am.
tell me the names of the bones.
In proximal row from lateral to medial, scaphoid, lunate, uh, uh, tricuteral, and scaphoid, and
Scaphoid again.
sorry, ma'am, pisiform.
Okay. And then on the in
And
the second row or distal row?
in second, lateral to medial tricutrium, uh, tricuteral, and capitate and hamate.
Okay. What type of all right, okay. What are the muscles which form the thinner eminence?
Uh, 4 muscles: opponens pollicis, abductor pollicis longus, abductor pollicis brevis, and adductor pollicis.
Thinner eminence is formed by abductor pollicis brevis, okay,
Yes.
flexor pollicis brevis, and opponens pollicis. What is the nerve supply of thinner eminence?
Median nerve, excluding adductor pollicis.
Wait a minute. And what about
For
flex
adductor,
flexor pollicis brevis? Because
uh,
flexor pollicis brevis has 2 heads. Superficial head is supplied by the median nerve and the deep head is supplied by the ulnar nerve. Okay,
okay, ma'am.
so this
Yes,
is,
ma'am.
yes, not correct. Please have a look at picture on picture A here. Picture A, this is picture A on my right hand side. And here some structures are being shown. Please tell me what are you looking at and tell me the boundaries of that, what you are looking at.
Ma'am, this is the anatomical snuff box.
Yes, please. Quickly tell me the boundaries.
And middle boundary is of extensor pollicis longus, and lateral boundary is abductor pollicis.
Lateral boundaries?
Lateral boundary is extensor pollicis brevis, and
And
abductor
abductor.
pollicis.
Abductor.
Abductor pollicis
Yes.
longus,
Yes.
and medial boundary is
You
extensor
told me
pollicis.
medial. Now tell me the proximal border and the distal border.
Ma'am, distal border is the apex, which is formed by these tendons, and proximal boundary is ma'am, at the level of
Styloid process of the radius. Okay,
that
what
process.
forms the floor of the anatomical snuff box? Floor?
So I missed it.
Mm. So think. You just told me the carpal bones. Which carpal bone might lie here? Okay,
Uh,
another very important question for you as a surgeon. What is the significance of knowing anatomical snuff box?
Radial artery passes from here.
That is the
And
content. Yes, that is the content of the anatomical snuff box. What is the
And,
significance as a surgeon? Why should you know about it?
as floor is formed by a scaphoid bone, and uh, on fall there may be fracture of the scaphoid bone, and patient may complain pain, and the blood supply of the scaphoid bone is from the distal and proximal, and may be deprived of the blood supply, and that leads to necrosis of the scaphoid.
Avascular necrosis.
Yes,
Okay, that is one scenario. Okay. And the floor of the anatomical snuff box, it depends, it varies depending upon the position of the arm, hand, or the, yes, the wrist, I should say more precisely. Which carpal bone is in the neighborhood of scaphoid? One you told me, fracture of scaphoid bone. Okay, avascular necrosis can occur. In neighborhood, there is lunate bone, which can be dislocated and
dislocated and
what?
sorry.
So that can also cause tenderness in the anatomical snuff box, right? So one is scaphoid and the other
Avascular
one
necrosis.
is, yes, and the other one is that. Okay, please tell me on the left hand. Okay, on the left hand side, there are certain structures, excuse me, which are marked. How many of you can you recognize? Can you recognize number 13, please?
This is the extensor pollicis longus tendon. Extensor pollicis.
Extensor
Sorry,
pollicis.
extensor
Is it
index.
longus or brevis? I mean, does
This
it
is
have?
extensor indicis. Extensor
Wait, you're
indicis.
confused. You are really confused. Okay, number 16. Identify, please.
This is flexor extensor retina column.
Tell me the attachments, please.
On lateral side, pisiform and hook of hamate, and on medial side, attachment is on the radius.
Whole radius.
No,
Okay.
ma'am, styloid process.
See, this is not going to work, in exams. What passes below the extensor retinoculum?
Sorry, ma'am, what causes?
What passes below or underneath the extensor retinoculum?
Extensor tendons of the forearm, that includes, ma'am, extensor pollicis, extensor pollicis, extensor digitorum, extensor pollicis, and extensor. I missed.
You missed everything. All right. I can't
Extensor
ask you to. We'll do
extensor
the
carpal
station again.
longus.
Wait. Please identify number 19 here.
Ma'am, this is a flexor retina column.
Please quickly tell me the attachment and what passes below or underneath the flexor retinoculum.
Lateral attachment pisiform and hook of hamate, and medial attachment are
Okay. Muscles, you'll tell me, the tendons, you'll tell me later. Just tell me, median nerve passes above or below the flexor retinoculum?
it passes below the retina column, ma'am.
Okay, very good. At least you know that. Please tell me if you could identify number 29.
Ma'am, this is the palmar arch, superficial palmar arch.
Okay, please tell me how the superficial palmar arch is formed.
It is formed by ulnar artery and superficial branch of radial artery.
All right, okay. And what is the territory of supply of superficial palmar arch?
It supplies the ma'am tendons at the basis of the metacarpal bones, muscle at the basis of the metacarpal bones.
Okay, that's whereabout. I mean, near.
Uh,
Met
it,
I mean, I
yeah,
have to know it precisely, you know.
two,
We can't just take this layman answer. Anyway, all right. Please tell me, which test can you carry out to test collateral circulation of the hand? Describe it, please.
Allen's test, ma'am.
Yes, very good. At least you know the name. Would you be able to explain it?
Yes,
Or
ma'am. First, we raise the hand of the patient
yes,
and we compress both the radial and ulnar arteries and
yes.
ask the patient to make fist multiple times and then open it. And hand should be fade out, and we release the one artery and see whether there is a hand becomes pink within less than 7 seconds. Then the circulation is patent. Otherwise, that side is compromised.
All right. Please come here on the picture A. See, this
Yes,
is
ma'am.
thumb. Tell
Yes, ma'am.
me all the movements which are possible by the thumb and which muscles are responsible for which movements. Very quickly.
Ma'am, flexion
Yes.
and these are flexor pollicis. Ma'am, I have read, but I am not remembering it this time.
Okay.
Uh,
Both longus and brevis. Flexor pollicis,
yes, ma'am.
longus and brevis. Flexion. Okay. Now other movements.
Flexion, extension, and medial rotation and lateral
Come on.
uh,
Medial and lateral. I mean,
medial
no, it's flexion,
flexion,
extension, and then
extension,
adduction, abduction, opposition. 5.
opposition.
I don't know, you are telling me the movements of the hand or the thumb. I asked in particular for the thumb. Okay. Flexor distrum's last question. Okay, then I'll let you go because I understand you need to go back and revise this. Flexor distrum superficialis and flexor distrum profundus. How are these two tendons inserted?
Ma'am, superficialis tendon divides into two, and it is inserted in the bases of the middle phalanges, and the extensor tendon passes through the deviation of the superficial facialis tendon and inserted into the base of the distal phalanges.
Okay. Right. I think this is it. Right. Thank you.